This is CBS 11 News at 10.
Technology, it's supposed to make life easier most of the time, and it could now help doctors help patients. That story coming up. And welcome back. These days, most records are electronic. Now your health records could be going the way of your bank statements. When you go to the doctor's office, you can count on seeing pen and paper, but times are changing.
When I go into the room to see my patient now, I actually carry an iPad, take a photo of the patient, enter all the information on the iPad, and then all your testing and other information is entered directly into the computer.
The medical community is now going paperless. Paul Cartland is in charge of upgrading the state's health technology.
Remember that part of HIPAA, the P is for portability. The whole point was to make it possible for your personal health information to be able to be exchanged, to be portable.
It's actually now law that the healthcare industry go paperless.
The American Reinvestment and Recovery Act had a piece in there called High Tech, which was about the health information exchange and electronic health record incentives. That set some additional criteria around privacy and security of health information.
How about that?
Rebecca Madison with Alaska eHealth Network says going paperless helps doctors help patients.
You can have a broader look at the patient by looking at all of their data than if you are trying to go through multiple pages of paper.
Dr. Melinda Rathkop works at the Allergy, Asthma, and Immunology Center of Alaska. She says it's all about efficiency.
We did the change about 3 years ago where everything was on paper and switched to electronics healthcare records.
But how safe are your records?
That's the #1 challenge. How do we keep ahead of the people who are trying to break into systems or who are either for malicious or just fun intent or whatever they have going on. But how do we do that? We have to keep up daily almost with, new rules coming out and standards for security.
The answer, electronic locks.
One of the things that we've made very sure about is that everything is encrypted from the place it's setting at rest to the place it's transporting to the place it ends up.
Paperless health records can also be critical during a natural disaster.
I was stationed in Biloxi, Mississippi, and I was not there during Hurricane Katrina, but heard back stories. Medical records was in the basement of the hospital. So medical records was completely flooded. So all those paper charts were flooded at the time and then moldy and unusable.
If your doctor's office hasn't gone paperless, chances are it will soon. And so far, Providence and Alaska Regional have already started the process, and going paperless with your health records could also save your life. That's tomorrow night on CBS 11 News at 10.